About 15 years ago, I was diagnosed with diabetes. And that was the beginning of this journey that I've been on for better health. I changed my diet. I had oral medication. Then I ran into a period when I didn't have the same kind of health care or health insurance that I had previously had. Frostbite brought me to the emergency room. And in the emergency room, they determined that, well, you've got frostbite, yes, but you also have peripheral artery disease. And when I began to learn more about it, I realized that I had been suffering from the symptoms, but had not recognized those symptoms. The diagnosis of the PAD gave me a heightened awareness about how close the relationship is with diabetes and high blood pressure. When you understand that they're all connected, and I've got a great understanding of it because I've got great clinicians in a great setting who make sure that they're collaborating and make sure that I understand what it is that I'm facing so that I'm doing the right things. I sort of push the envelope and become a bit obsessive and maybe a little obnoxious about it with my clinicians, but I want to live as healthy a life as I possibly can. So I know that they are the keys to that. Being an advocate didn't just come from nowhere. When you look at the history, the lack of access or experience, and our skepticism about the science, it sort of begins to add up to there's a distance, and it's a distance that we need to close. So closing that gap requires that both sides of that equation, the patient, the community, the culture, and on the other side, the industry, the researchers, the clinicians, that we find a way to close that gap together.